Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students. And that's what I intend to do with this podcast. On today's episode, I have some special guests for my university's undergraduate nursing research and EBP course. Demi Aluko, Dillon Anderson, Harper Darbonne, Vivian Earl, Ruthie Melancon, and Jacob Oswald are joining us today to discuss their evidence-based practice project. Let's turn the show over to Vivian to get us started.
Hello, everyone. My name is Vivian Earl, and on behalf of my group members, I'd like to welcome you to our podcast discussing the work we have completed in our undergraduate nursing research and evidence-based practice course. The title of our presentation is Reporting Systems with Confidentiality Protections Related to Lateral Violence Bullying Amongst Nurses, and the members of our work group are Demi Aluko, Dillon Anderson, Harper Darbonne, and Ruthie Melancon. We are all undergraduate nursing students at McNeese State University in Lake Charles, Louisiana.
Thank you for introducing your team to our listeners, Vivian. I know your group members are currently in the 6th semester out of a total of 8 of the McNeese State University BSN curriculum. Your group is about 1 year from the end of your BSN program and entrance into the RN workforce as new graduates. It's interesting that your group decided to take on the issue of lateral violence in nursing. Harper, can you tell our listeners a bit more about why you feel this topic is important?
As said before, we are nursing students, so we selected this topic because it is not only common for nurses to face this lateral violence, but even more common for new nurses or new grads to face this lateral violence. Lateral violence leads to high turnover. This means that many nurses may even choose to leave their position due to this. We wanted to see what measures could be implemented and what would be effective in decreasing lateral violence. Lateral violence is harmful, destructive behavior exhibited by one nurse towards another. This lateral violence can also be exhibited among any coworkers. This is often repeated on multiple different occasions. A confidential reporting system is a mechanism that allows employees to report inappropriate behaviors with the guarantee that those reports will stay private. Examples of common forms of bullying in the healthcare system include passive-aggressive behavior, undermining actions, and verbal abuse. Although there is an increased awareness in this issue, nurses are hesitant to report incidents due to fear of retaliation, lack of trust in their supervisors, or damage to their reputation. Nurses who experience workplace violence can face high levels of stress and burnout. To resolve this, reporting systems are very important, but these reports must be kept private to protect the nurse. Confidentiality guidelines encourage nurses to report. When nurses face violence from coworkers, it can not only affect them, but also the patient's outcomes and the quality of care provided. Decreasing lateral violence leads to a better overall work environment and more effective practices. If there's a better work environment, nurses and coworkers are more likely to enjoy the work they do. If nurses are not worried about the bullying they face at work, they can focus on their patients, which can decrease errors. Not only would a confidential reporting system improve the mental health of nurses, but also significantly elevate patient safety measures. It is a very important topic as it affects the hospital, the nurses, other healthcare workers, and most importantly, the patient and their families.
Thanks for explaining what lateral violence is and for giving us some examples within the nursing profession, Harper. You've provided our listeners with a solid background for why this overall topic is significant for the nursing profession. So, Ruthie, can you tell us what your group did next within this overall EBP project?
Since Now, we've established the significance of our evidence-based practice topic. I want to share our evidence-based practice question with you all. We have created our question using the PICO framework to define our population, intervention, and outcome. Our research question is, will implementing a report system with confidentiality protections amongst the nursing staff reduce lateral violence, also known as nurse-to-nurse bullying, in the healthcare system? This question guided our literature search to identify the most relevant topics and helped us to find high-quality evidence.
Thanks for sharing your group's evidence-based practice question with our listeners, Ruthie. This question served to focus your group's investigations into the literature. Can you tell us more about how you used that PO question to help you find published studies about your selected topic?
To find the best evidence, we used our evidence-based practice question to create keywords for searching our university library databases, such as Academic Search Complete, ALT Health Watch, Cumulative Index to Nursing and Allied Health Literature Complete, Health Source, Nursing/Academic Edition, Cumulative Index to Nursing and Allied Health Index Plus with full text, SOC Index with full text. Our search terms included reporting systems and bullying, workplace violence and bullying, bullying and nurses, reporting systems and workplace violence in healthcare, quantitative research and bullying and nurses, nursing and lateral bullying, horizontal violence and nursing, lastly, systemic review or meta-analysis and nurse violence. We also applied limiters such as only peer-reviewed articles and publication years from the last 5 years to ensure high-quality results. During our search, we found that we had some trouble finding actual research articles, as lots of them were summaries of articles. We successfully were able to find studies in multiple regions of the world in order to broaden our research and studies.
I appreciate your sharing some helpful insights into your group's literature search process, Ruthie. It seems that your group did a really nice job of sifting through the retrieved literature to distinguish between overall narrative review articles and then the primary source quantitative research studies. So after your group reviewed these peer-reviewed studies, what key evidence did you discover about your group's PO question?
One of the biggest takeaways is that reporting systems work, but only if nurses feel comfortable using them. Our studies showed that when healthcare workers are properly trained on how to report workplace bullying, and when leadership actively supports these reports, the rates of lateral violence go down. On the flip side, if nurses don't trust the system or fear retaliation, they're way less likely to speak up, which allows the problem to continue. Another key point that we focused on is how workplace conditions themselves contribute to bullying. When nurses are dealing with role conflicts, short staffing, or just overall stressful environments, which we all know that's very possible, tension builds and bullying becomes more common. Having a structured, confidential reporting system helps hold people accountable and can improve the overall work culture.
Now, Demi's going to cover a few more pieces of evidence that we found throughout our research that were very insightful.
One key piece of evidence we found while synthesizing our research articles is that it is essential to train workers to promptly report acts of violence to the appropriate authorities. Nurses should receive this training because, naturally, as humans, we tend to keep certain experiences to ourselves rather than share them with others out of fear of retaliation or being perceived as a culprit by those we confide in. However, sharing a problem with someone who can help is a way to address it. This dynamic also applies in the clinical setting, which is why it is important to train nurses on how to report these cases and understand the chain of command they should follow. Such training encourages nurses and boosts their confidence, reinforcing that the administrators expect this from them and assuring them that something will be done about the reported cases. This also relates to another key piece of evidence that my group found. A reporting system that clarifies procedures and demonstrates a commitment to taking responsive actions reduces the rate of lateral violence and bullying. The confidence that nurses could gain from receiving training to report acts of bullying effectively is not sufficient to encourage them to report these cases. A system that ensures responsive action is taken towards cases resulting in a reduction of bullying in the clinical setting is crucial for ensuring nurses report these incidents. If nurses believe that their act of reporting will yield positive results and lead to better outcomes, they are more likely to report these cases. Some additional evidence we found while synthesizing our articles included studies that were primarily cross-sectional, where data is collected from multiple individuals at a single point in time, and longitudinal research design, where data is gathered over an extended period of time. The sample size of these studies predominantly consisted of healthcare workers and nurses also. This enhances the reliability of our research findings regarding how lateral violence and bullying can be reduced in the clinical setting among nurses.
Excellent discussion of the studies that your group reviewed, Dillon and Demi. I heard a common thread of advocacy throughout your discussions. Specifically, it seems that the reviewed studies proposed that nurses must have the tools needed to advocate for their own safety, and that leaders and administrators need to advocate for their staff within an overall work environment as well. Can you tell our listeners about some of the key implications for nurses across multiple different clinical specialties? What should those nurses consider based on the literature your group reviewed?
Based on our findings, we identified several important implications for nursing practice. To ensure that reporting systems are appropriately applied in the clinical setting, all clinical staff must be properly trained in the understanding and importance of a confidential reporting system. Following this understanding, leaders in the healthcare system should promote a safe and supportive environment that allows employees to feel confident that their reporting will remain confidential. It should also be known that not all bullying incidents will be reported, so staff and leaders should be trained to recognize and respond to lateral violence when it is seen. Although all nursing populations are subject to workplace violence, these findings are especially relevant to new graduate nurses who are at an increased risk of being bullied in the workplace due to their quote, newbie status. Being that we are nursing students, our research was driven by our curiosity on how bullying is being prevented in the workplace. Implementing confidential reporting systems will increase the satisfaction and retention of new grad nurses in the healthcare setting. Our research stresses the importance of staff feeling supported by their leaders. Implementing these practices mentioned will promote a sense of empowerment among employees, prevent bullying, and promote improved integrity in the workplace. Implementing a confidential reporting system for workplace violence not only protects employees, but also improves the overall functioning of the clinical setting and benefits everyone involved.
Thanks, Vivian. You provided our listeners with some helpful takeaways pertaining to how to make real-world improvements within the nursing practice environment. This is especially important to your futures as new graduate nurses in about 1 year's time. I know you all hope to be employed in settings that advocate for your safety while actively working to eliminate nurse-to-nurse violence. So, Dillon, did your group find that there are any gaps in the current literature that may require further research investigations in the future?
Within the studies that me and my group researched and synthesized, we found that even though we know workplace bullying in nursing is a problem, there are still major gaps in research that need to be addressed. Our group identified a few key areas where future studies could make a real difference. One big issue is that reporting systems aren't always being used. Nurses might fear retaliation, distrust leadership, or believing nothing will change. Research should focus on these barriers so we can create systems that nurses feel safe using. Additionally, confidentiality is seen as another concern. Even when reports are meant to be anonymous, nurses may still worry that their identity could be revealed. Future studies should explore how these concerns impact reporting and what can be done to strengthen privacy. Bias is another factor that can always play a role. If leadership is conducting research themselves, they might not fully understand the experiences of their own nurses. Studies need to include diverse perspectives to get a more accurate picture of the problem at hand. Finally, in quantitative studies, honesty can be an issue. Nurses might not feel comfortable answering truthfully on surveys, especially if they fear consequences. Future research should look at ways to collect more reliable data like fully anonymous surveys or combining quantitative and qualitative methods. At the end of the day, researchers shouldn't just ask if reporting systems exist. It should ask if they work. By addressing these gaps, we can create safer, healthier workplaces for nurses and better outcomes for patients.
Okay, so your group has given us a lot of excellent information about the current state of the science pertaining to your selected clinical practice topic. After all of these research studies that your group reviewed, including considerations for weaknesses of the studies and continued gaps in the published literature, what was your group's overall literature-based answer to the original PO question you shared with us earlier?
Lateral violence has been proven to lead to burnout in the nursing profession. This leads to a mass exodus of nurses leaving the profession as a whole. In the research, we learned that it is essential to properly train employees to report any potential acts of violence immediately. The literature does support our evidence-based practice question that Ruthie mentioned previously in the beginning of this podcast. This indicates that implementing confidential reporting systems in healthcare settings can significantly reduce lateral violence. Research suggests that nurses feel more at ease in their work environment when they have strong support system from upper leadership. Implementing a confidential reporting system allows organizational leaders to actively show their dedication to fostering a supportive and respectful workplace. Additionally, a well-designed system ensures thorough documentation and resolution of incidents, effectively discouraging repeat offenders. Collectively, we took some time to reflect on some things that we learned as a group throughout this group project. Vivian learned that implementing confidentiality precautions into the workplace to combat violence is only effective when the nurses feel like they have support from their managers. Harper learned that confidentiality guidelines makes nurses feel more confident in reporting workplace violence. Dillon learned that stressful environments play a huge role in lateral violence within the workplace. Ruthie says that she learned that leadership roles within the healthcare setting have more responsibilities than she first believed. Demi learned that nurses cannot provide thorough care to patients while working in a hostile work environment. I learned that when nurses feel like they have the support from their management, they feel more respected, and it makes them feel like their concerns that they're sharing are being heard.
Thanks for wrapping up your group's discussion, Jacob. I'm proud of each and every one of you for integrating the content that we've discussed in our undergraduate nursing research and evidence-based practice course into a real-world literature search process. Your group learned some very valuable lessons for your future nursing practice through the completion of this project. Whether you think it's possible now or not, you will be in leadership positions in your future RN practice. I hope you remember these lessons so that you can advocate for yourself and for your coworkers, no matter where your nursing journey may take you. I'd also like to thank our listeners for going on this journey with us. Nursing is a stressful profession, but there is hope that integrating research findings like those discussed in this podcast can transform our individual workplaces and our collective profession to help nurses find more joy and meaning in the important work that we do. If you know a nurse, thank them for what they do. And thanks again for listening.